of Sherlock Holmes. Sherlock Holmes, the quintessential detective. And essentially, what are we as physicians? We are detectives. We look for signs and symptoms, our clues, and that helps us create a diagnosis. So I thought we might try something today, quickly here, with our, very good, with our Sherlock Holmes. And these are all the cases of Sherlock Holmes. And what I'm going to do first is I'm just going to have you say stop at any page. Are you satisfied with this page? Because I'm going to ask you to look at the first word at the top of that page. I cannot see it. Is that okay? And have you remember that? Okay? Very good. And I'm going to ask, if I may, I'll have you say stop at any page. Are you satisfied with this page? I'll have you look at the first word. Okay? Very good. Now what I'm going to do is I am going to ask, if I may, I'm going to hand you the book in just a moment. And when I do, I'm going to ask you, please, to turn to any page you want. I'm going to ask you not to look at the first line, not to look at the bottom line on the page. And I'm going to ask you, please, not to select a name, because I know Holmes and Watson and other names are here, and so I don't want it to be a name. What I want you to do is just open the book, scan in the body of it for a word. And I'd like you to pick a big word, a long word, if that's okay, more than 5 letters, because that'll make it more impressive. Okay? So I'm going to ask you, please, just to, and I just want you to go through, find a word, and then I'm going to ask you, please, just to remember that word when you found it. And I'll take the book back, I'll have you stand up, if you will. Please, thank you. And then, I'm going to do the same. Please, not the first line, not the bottom line, and please not a name. That makes it too easy. So I want you to go through and silently select a big word, okay? More than 5 letters. And once you've got it, I'll take the book back and I'll have you stand up. Excellent. Thank you. Please, I'll have you rise up before time, and in these days, I'm going to ask you to do the same. I'm going to have you, please, not the first line, not the last line. That's too easy, and not a name. And I'll just have you select a word. And once you've got it, have you stand up, and then we'll do the same here. Okay, not the first line, not the last line, not a name, it's too easy. And once you've got more than 5 letters, bigger word, once you've got it, very good, have you stand up. Okay, very good. Now what I'm going to do, those of you who are standing, please, I don't want you to do anything yet, but I want you all to think of your word. I want you to think of it. Okay, wow. The chip in my brain is receiving the signals. And I'm getting 4 words. Please don't do anything yet. But I want you to hear the 4 words. Happenstance, presence, morning, and throne. If I mentioned your word, please sit down. Thank you. Now we have 2 more words that were selected at random, yes? As you're thinking of your word, it reminds us that hopefully the lecture today was clear, concise, organized, so that the information was well understood. Is that correct?
Yes.
And now you're thinking of a word that reminds us. When patients present with symptoms, when patients come to us in distress, we do our best as clinicians and physicians to make an accurate diagnosis, to take those symptoms. And remember, we look at age, gender, we look at time frames, onset, frequency, duration. We look at family history because we know there's a genetic predisposition both for illness and for response to treatment. We look at past illness, past treatment approaches, so that we know our diagnosis and our treatment intervention is not a coincidence. Is that correct? All right. Thank you.